Hi, I am Dr. Datta Reddy Aakiti, Consultant Endocrinologist at Yashoda Hospital, Malakpet. On November 14th, we witnessed World Diabetes Day, occasion of birth anniversary of Dr. Frederick Banting, who is the inventor of insulin. Insulin is the most important treatment for the management of diabetes. So this year theme for the World Diabetes Day is the access to care. So that means everybody should have access to the diabetes care. At the same time, everybody should have the knowledge about the diabetes. Diabetes is the most common metabolic disorder which occurs due to the lack of insulin secretion from our pancreas, or if our body does not utilize insulin properly, which also lead to the excessive blood glucose levels. So this high blood glucose levels will lead to the complications of diabetes. So there is a prevalence of diabetes is rapidly increasing throughout the world, and in India more than 100 million adults are living with diabetes. So the increased prevalence of diabetes is due to the unhealthy food habits and lack of regular physical exercise. And the symptoms of diabetes are increased thirst, urination, loss of weight, and some people also feel easy fatigability. And the blood glucose levels are uncontrolled in the long term, which may lead to the chronic complications of diabetes like diabetic retinopathy, diabetic nephropathy, diabetic neuropathy. At the same time, it increases the risk of heart disease and brain stroke. And once you have the symptoms of diabetes, or even if you have more than 40 years of age, so you'll go for the evaluation of the diabetes. So once you're diagnosed with diabetes, with the proper lifestyle changes, we can control the diabetes. At the same time, we can prevent the occurrence of chronic complications of diabetes. So the lifestyle changes includes healthy food habits like reduced consumption of the carbohydrates, especially refined carbohydrates should be reduced, and the diet should be balanced, which should contain carbohydrates, fats and proteins, and include more amount of fresh fruits and vegetables, which contains the high fiber, which will reduce the weight. At the same time, which also control the blood glucose levels, reduce the amount of refined sugars and sugar sweetened beverages, and do regular physical exercise like brisk walking for at least 30 minutes per day, and go for the regular checkups, take the regular medications as advised by the doctor. And if you control these things, we can prevent the chronic complications of diabetes. And most of the patients with the diabetes also will have other comorbid conditions like hypertension, dyslipidemia, obesity. Along with the diabetes, we need to control the hypertension, dyslipidemia and obesity. So by doing that, we can live healthy as like non-diabetic patients. Thank you.